Good day, everybody. We're going to get started here in a moment after everybody gets their audio setting connected. So give us just about 30 seconds. Okay, it looks like we can get started. I hope everyone's having a wonderful day so far. Thank you for joining us for the Integration of Culture and Behavioral Health. I am Megan Dotson. I'm the program manager for the National American Indian and Alaska Native MHTTC, and we're located in Iowa City, Iowa. Today's speaker is Jason Butler, and we'll get to him in a moment. This is our network across the MHTTCs. We have 10 regional offices and a network coordinating office, our office in Iowa City, Iowa, and then we have a national Hispanic and Latino MHTTC as well. So we are funded by SAMHSA. So the content of this event is the creation of the presenter, and the opinions expressed do not necessarily reflect the views or policies of SAMHSA, HHS, or the American Indian and Alaska Native MHTTC. Following today's event, you will receive a follow-up email. I usually get asked a couple times throughout the presentation if you'll receive the PowerPoint slides, and we do provide them in a handout version in a PDF file. So those will be emailed to you as part of your registration process. We do have your email address, so be patient with us, and we'll send you that throughout the week. We also have a link to our recording in there and a link to our evaluation survey, which we appreciate you filling out to let us keep providing free training. So we do like to take this moment to acknowledge the land and pay respects to the indigenous nations whose homelands were forcibly taken over and inhabited. Past and present, we want to honor the land itself and the people who have stewarded throughout the generations. This calls us to commit to forever learn how to be better stewards of these lands through action, advocacy, support, and education. While injustices are still being committed against Indigenous people on Turtle Island today, we say thank you to those who stand with Indigenous peoples and acknowledge the land. Reparations must be made to allow healing for our Indigenous peoples and to Mother Earth herself. We do like to acknowledge this painful history of genocide and forced occupation of Native American territories, and we respect the many diverse Indigenous people connected to this land on which we gather from time immemorial. This was actually put together by 3 of our staff members that are from the Meskwaki Nation, listed here below. So with that, today's speaker is Jason Butler, and I'm going to let him introduce himself, and then we will get started with our presentation today. Thank you, Jason.
Yeah, good afternoon, everyone. It's a pleasure to be here. My name is Jason Butler. I am a member of the Ute tribe from Fort Shane, Utah. I currently reside in Fort Hall, Idaho, where I work for the Shoshone tribes. Here is the community health representative manager, but my background is in behavioral health, so I've done a lot of work in that field. So I think a lot of what I've chosen to do has to do with integration of culture, and a lot of the work that I've done kind of focuses on identity and things like that. So I'm not going to spend too much time. I think Megan said she got this stuff out to you, so if you want to take a look at the bio, you're welcome to do that, but we have a lot to cover today, so I don't want to spend too much time with all that stuff. We're just going to jump right into this. So let me get PowerPoint up. And is that good for you guys? Can you see that good?
Looks great.
Okay, so integration of culture into behavioral health practices. So as I stated before, I've done a lot of work in this area. Okay, let me just figure out these buttons here. Okay. So, you know, what I wanted to start with previously, I don't know if you guys are familiar, but I've done a few of these webinars before. So one of the ones that I did previously last year was the importance of the integration of culture into behavioral health practices. So I'm going to do a quick overview of just the beginning part of that, just to kind of give us a little bit of background of why this is important. But I'm going to kind of blaze through this pretty quickly because I want to get, I want to focus a little bit more on the integration part, so rather than the background info. But I know a lot of you guys, if you're working in behavioral health, you're probably familiar with a lot of this stuff. So, like I said, I'm just going to kind of cruise through this pretty quickly. I'm in my office right now, so phone may ring from time to time. But one of the important parts of all of this is really when we talk about, I think, behavioral health in Indian country is really just getting to the root of the issues and a lot of the problems that we have on our reservations and communities, whether that's on a reservation or in urban communities. I think a lot of times the issues that we face as Native people are pretty universal, and I've listed some of those here: poverty and unemployment, domestic and sexual abuse, alcohol and drug use, suicide, poor health conditions, and that's in terms of physical, mental, emotional, and spiritual health. The conditions that we face in our communities, increased death rate, low mortality rate, and then a loss of culture. We look at that, and does that loss of culture belong on this list? A lot of times we can look at that and see that a lot of times it's a product of some of these things. But I think we're all aware when we look at the communities that we're from, or even when we look at ourselves and how we've been raised or how we grew up, and you can look at this list and how many of you have been affected by these things. I can look at my own life and the way that I was raised and things that I've seen, and I've been affected by all of these things, and when we look at that and compare that to just mainstream society and people in general within the United States, a lot of times people aren't growing up with all of those things, whereas a lot of times when we're gathering together in communities, regardless of where that's at, when we're talking with Native populations, a lot of times most people can associate with this entire list. So, that's a really big issue. A big part of that, I think where a lot of that stems from is just the assimilation into Western society. When we talk about, the opposing ideologies that we have between our traditional teachings and our culture and modern society and what we've been thrown into here. And that's across the board. When we talk about religion, we talk about capitalism, individualism versus collectivism, connection to our Mother Earth, which is opposite of what we see every day in modern society. And a lot of times we're a part of that now, it's in stark contrast to really who we are, but at the same time, we're in there, the family structure is completely different. Just when we look at it, it's just an overall way of life difference, and there's a struggle to adapt there. You may not see it because you can look at people like, take me, for example, you can look at me and I'm in my office and I'm working and I'm doing a webinar, I'm doing all these modern things, right? But at the same time, there's struggles within our lives where we're trying to still adapt to this way of life. And we look at, I think, when we look at time, we can look at, my parents' generation or my grandparents' generation. I was fortunate enough to know my great-grandparents and their generation, right? The things that they have seen and what they've been through, and that ability to adapt, but also the struggle to it, and all of those things that came about that we saw on the list previously. So, I think what comes of that, and we've heard a lot of talk about this in the last few years, is historical trauma and intergenerational trauma. A lot of that comes from the forced assimilation and genocide, relocation, boarding schools, intergenerational trauma, the poor living conditions, and again, the struggle to adapt. And we see that manifest itself in a lot of the things, again, on the same list that I showed on the previous slide. And like I said, we can go into any community and ask people, how many of you are affected by these things, And it's all of us, we've all been affected by these things. And we can look at some of this list again, and people may say, and this is a common phrase that you may hear, is, well, that was a long time ago. Well, it wasn't. because my grandparents told me about these things. My great grandparents told me about these things and their experiences with them, you know. And looking back now, I can look at how that shaped the way our lives were, you know. And that, I think the level and the ability to adapt is different for everybody. So, you know, you have people that have made it out and made successful lives of themselves. You have other people that are still in that struggle to adapt to this society, which is what brings us here today. You know, I think a lot of us that have made it to a certain point in our lives feel that we have either a responsibility or an obligation on several different levels to do something about that, you know, and to try to make a positive impact on that, which is, again, why we're all here today. So, you know, and then we talk about, you know, the importance of culture and who we are. When we look at that list and some of the things that we've been through, especially like the boarding schools and the, you know, the forced assimilation and things like that, and we look at, you know, how that impacted our culture and our identity, you know, and that's really what that is the identity, who we are. You know, if we don't have those components of language and teachings and roles and, you know, again, the things that make us who we are, then do we know truly who we are? You know, it gives meaning to our lives when we know those things, you know. It offers solutions to all the many obstacles that we face in our lives. We think about how hard life can be, you know, from time to time. And again, that's different for everybody, but at the same time, the thing that's universal, regardless of what tribe you are, is that the answers to all of the questions and all of the struggles that we have are found within our identity. It's found within our culture, within our teachings. There's answers to all of those struggles, but if we've been removed from that, or for whatever reason haven't learned those things, we're going to have a hard time when it comes to facing some of those obstacles because we're not going to know where to turn. You know, it helps us to define our roles within our family, community, tribe, and society. So again, we talk about that difference in ideology between who we are and mainstream society today, where we have that, you know, idea of collectivism, you know, and our roles within our family, you know, what role we have to play, what responsibilities we have to family. And that whole thing is different when we talk about our family structure compared to, again, modern society's family structure. You know, I was in a training not too long ago where we had to do these family trees, right? And like people had family trees as like their parents and their siblings and maybe a grandparent, maybe not. You know, it was pretty small. It was pretty quick activity for them. For me, I would take like 2 pages and I could only list it on there the people that I had contact with. Because that was 2 pages worth of people, you know. And then there's all these other branches of people that I know who they are. I just didn't put them on there because I didn't have time to do that, you know. So, you know, we look at that whole aspect of it, family and community, and then just within our tribe, you know, that's a whole different thing when you talk about, you know, when we go out and decide to take on a thing, whether that's good or bad, we're representing our people. We're representing our tribe, our community, our family. You know, there's a sense of, again, collectivism in everything that we do. And then we just ask ourselves, you know, how prevalent is cultural practices today? You know, look within your own life or within your family, within your community, and how prevalent is that of people, you know, practicing traditional ways on a daily basis. You know, and I'll let you answer that for yourselves, but you know, I know for me that's a struggle to try to live almost that dual life of trying to figure out how you balance those two things, you know. But again, trying your best to try to incorporate that into your personal life. But again, now what we're doing here, trying to figure out how we can incorporate that also into our professional life. So, you know, finding balance is an important part of that. And this is something that you'll see a lot of times because, again, a lot of the issues that we face and some of the things that I mentioned earlier, we look at some of those things and it turns into this thing where you have this huge lack of trust within our communities for some of the methods of treatment that we have. And you can see that across the board, whether it's, medical treatment or behavioral health treatment, whatever it may be, any type of modern treatment that exists today, you have people within our communities that are going to be skeptical of those things and are not going to trust them. You also have a lot of older people that still believe in traditional healing ways. So, they may reject that altogether. And this is what you see a lot of the time. So you'll see like behavioral health professionals and services are extremely important in Indian country versus Native American culture. Where you have that idea that these two things are completely separate and they are against each other. They're not the same and they don't belong together. Evidence-based practices are highly effective versus Native culture and Native medicines. And that's one of the debates that we have. Well, we have these two things, which one is right and which one is wrong? Western knowledge can help solve our problems versus Native American culture can solve all of those problems. Okay, so where were we? So finding balance. You have those clashing ideologies, so you kind of start to shift that. The idea is that we find a balance between those two things. So, you can change that whole phrase to behavioral health professionals and services are extremely important. Let's change this slide. So behavioral health professionals and services along with Native culture are extremely important in Indian country. Evidence-based practices along with Native culture are highly effective. Western knowledge along with Native American culture can help solve our problems. So we've kind of gotten to a point where we're kind of shifting that whole mentality from two things that are completely opposite being against each other and versus each other to kind of incorporating them together, which is what we see a lot of times in our communities today, right? But I think what we're doing a lot of times is we go to school and we get this knowledge and we get trained on how to implement these clinical services and we get certificates and degrees and all these things. And then we say, well, we're going to use all of this knowledge and we're going to incorporate some of our own traditions into that, right? I think the idea behind, the way I'd like to see things work is a little bit more like this, where we have Native American culture with the help of behavioral health professionals and services are extremely important in the country. Native American culture with the help of evidence-based practices are highly effective. Native American culture with the help of Western knowledge can help solve our problems. Where we're shifting that from this idea that we can take the knowledge that we've acquired from academia and then incorporate some of our own stuff to say, you know what, we have our own stuff. Let's go out and get this knowledge and maybe it can help with whatever we're doing, So finding ways to do that, I think is the tricky part a lot of the time. So, I think when we get started with this, the important thing, people want to figure out how do we do that, involve culture department. The important thing is to involve the culture department and elders and community members, we want to make sure that we get accurate information from credible sources in order to do that. We want to make sure that things are done the right way. A lot of times when we talk about culture and protocols and depending on, whether you're talking about ceremony or non-ceremonial things, there's a certain protocol. There's a certain way to do things. Again, those are all found within our teachings, but if we haven't learned those things, we have to find a way to get that information, right? And I think, involving elders or community members, spiritual leaders, and then a lot of tribes have their own culture department and language department. So I think going directly to those sources to get some of that information can ensure that not only are we getting accurate information, but we're making sure that we're doing those things the right way, as to not, offend anybody or again, do things the wrong way. A lot of the traditional practices and cultural practices are community-based to begin with. So, it's important to make sure that community is a part of that process. Whether it's in the beginning stages of implementation or once you get into actually doing some of these things, that you're including those people within whatever it is that you're doing. Creating partnerships in the community also builds trust. So you want to make sure that, we're getting the right information, we're doing it correctly, but we also want to start building trust when we talk about, whether it's the methods of treatment that we're using or whether it's the individuals that are seeking those treatments. We want to make sure that there's trust all the way around between our community, between our patients and clients, between our providers. We want to make sure that there's a level of trust in all areas. It helps the community to understand the connection between culture and wellness and healing. So again, a lot of times I think when you have individuals that are suffering from, some of these issues that we have, there's community members out there that don't fully understand what those issues are, or why it affects people a certain way. Like how often do you hear, well, why do they do that? Or why can't they just do this? Why can't they just stop doing that? Those particular phrases and those comments and that judgment comes from a place of misunderstanding, so if we can start to teach people, the ways to heal each other and to help each other, we start to kind of reduce some of that judgment. It also allows us to maximize our resources. So if we look at, our communities and we have all these services and programs that are there meant to help our people, sometimes we become fully dependent on that. And we forget that as community members, we have ownership of these issues as well. So if we have ownership of some of these issues, then we also need to take ownership in trying to find solutions to some of these problems. So, I think doing some of these things a lot of times helps us to maximize those resources. And once you have people that have that sense of ownership, they're a little bit more inclined to be a little bit more helpful and be a little bit more involved in trying to solve some of the issues that we have. So again, it ultimately helps us in the reduction of stigma and labels, which, I think can help in a lot of different areas, not only to get people into services, but also to help keep them involved in those services, but also once they start to heal, to be able to just fully come out and be a positive member of our communities, without having to feel that judgment. So those are some important key points there. And then there's many ways to do this. So when we talk about the integration of culture, how do we do that? Language is an important part of that. The roles and responsibilities that we have as individuals, as community members, as a whole, morals and values, our cultural activities, whether that's ceremonial or non-ceremonial. And then, there's a whole idea of personal level versus community level, Again, I think a lot of times when we talk about, our modern day society, we look at it and we say, well, it's all about the self and it's about me and, every man for himself. But at the same time, when we talk about a lot of our communities, it's a whole different thing where, again, we have that collective mindset. So let's get into some of these little areas here and talk about language. One of the important things that you can do, I think, in implementation into your own programs and into your own department is having your staff learn to greet clients and your patients using native language. So, that's one of those things where a lot of times we look at, I think we sometimes get blinders on. And again, we think we go to school, we get these degrees and certificates, and then we have to go and we have to do this thing a certain way. But, we sometimes forget that, especially in Native communities, the populations that we're serving are unique to anything else in the world, And a lot of times you can just say, Native American or Indian or Indigenous or however you want to say that. And we forget that there's over 570 some tribes, right? All with their own language, all with their own beliefs and creation stories. So if we're going into a particular community, it's very important as professionals to get to know that community. And a part of that is the language, you know. And some of those are just as simple as being able to say hello or good morning or just greeting people that come through your doors in their language. Again, including the culture department and language speakers to assist in that integration. And including them in activities, building signage, within your buildings, whatever it may be, the bathroom or the break room, or, we, at the treatment center I was at, we were, built a garden back there, and before I had left there, I was working with the language and culture program to get signs built to label the different vegetables with the Shoshone words for them. We never did get that far, and I ended up taking a different job, but those are just some different ideas of how you can do that. And then asking them to participate in program functions. And that way you get again, information from the source. So, for example, I worked for the Four Directions Treatment Center before I was here on the Shoshone Tribes Reservation, and we had a peer support program. So, one of the things that we did is we had our meetings online, we had a community prayer online, we had classes online, but what we would do is we would invite the culture program. So they would have elders log on, and they would sit there through the whole class or through the whole meeting and listen to what everyone had to say or listen to the lesson for that day. And then at the very end, they would teach us different words that went with some of the things that we were talking about, or throughout they would interject some of the language into that. But they would also, after listening to all of it, they would talk about the cultural relevance of what we did. And it may, I don't know, sometimes it would help them to think of a story or something. They tell us a story, or they just tell us a teaching or something that was relevant to whatever it is that we were learning that day. But from a cultural standpoint and coming from an elder, someone that we respected. So again, inviting people with that knowledge to participate. Sometimes we think when we're doing these behavioral health things or clinical treatment or peer support services, whatever it is, we think it has to be like directly related to that, and we forget that there's all of these outside areas, and culture is a big part of that. So I think including individuals that have that knowledge and can help with some of those things is extremely important. And then encouraging the clients and patients to use their language whenever possible. So once you get into that whole idea of using that, and they see, people using some of those things, the language and some of the phrases, they get comfortable in using that. Because again, when we go back to some of that historical trauma, we have this like shame in using our own language. Sometimes we feel ashamed to do that. So I think, helping people along and trying to learn those things, but also encouraging each other to use those is extremely important. And it helps, again, to establish that identity. We talk about traditional roles. What are our responsibilities? Do our clients and patients know traditional roles and responsibilities? That's a really good question to ask. Again, when we talk about some of the issues that people are coming in to seek treatment for, can not knowing those roles and responsibilities be a big factor in why they're there in the first place? How does that impact behavioral health as a whole? How does that affect our well-being if we don't know those certain things? And again, collaborate with the culture department, elders, and other community members. Put together traditional roles specific to your community. Again, remember that these things are going to be different for every single community. But if you can start putting those things together, you can encourage clients and patients to fulfill those traditional roles. Roles may be adapted to our modern way of living as well. So, I'll talk a little bit more about a project that I did towards the end here, but, you know, figuring out what those roles are for each individual, and then asking people, you know, are you following those, or do you know what they are, you know? And again, how does that impact who we are and what we're doing, how we behave, our well-being, you know, our morals and values. So does the current state of being, does our current state of being match traditional morals and values? You know, the things that we're doing today, how we behave, what we do, what we say, how we treat each other, how we treat ourselves. Does that match our traditional morals and values? Collaborate with culture department. Again, it's the same thing, you know, collaboration with the culture department, elders, spiritual leaders, community members to create morals and values at individual and community level. You know, develop discrepancy, then encourage change in behavior. So we have these roles, we have morals, we have values, and looking at those things, you know, who we are today, does that match what that is? You know, and if it doesn't, we have to be able to develop that discrepancy to show people, like, look, this is who we're supposed to be. These are the things that we're supposed to be doing. These are, you know, the ideals and the way that we believe. Is our behavior the same as that? You know, can we look at those things and say that yes, we practice these things? And then once you can develop that, you know, you can look at it and say, well, you know, I do these certain things in my life, and there's a reason why I do that, because I'm not following this particular teaching. Or my elders are saying that this is the way that I'm supposed to do this, but I'm not doing that. And now I see how that manifests itself in my behavior over in this area. You know, so we can look at all of those things, and you can kind of get people to kind of on their own start to dissect their own behavior and how that either knowledge of these things or lack of knowledge in these areas affects, you know, what they're doing on a daily basis. And, you know, that's, I think, has an effect on short-term and long-term outcomes. So that's an important aspect of all of this. You know, cultural activities, that's a big thing. And again, you know, we talked about the difference between ceremonial and non-ceremonial things. But, you know, I think there's ways to implement those into your practice, whether it's daily prayers and traditional medicines. So I know a lot of people, you know, their teachings are to get up and greet the sun. And, you know, for us, we drink water and we pray. And we can burn cedar. I think a lot of people call that smudging, or, you know, smoking yourself off, or, you know, just burning cedar or sage or sweetgrass, whatever it may be. Again, that's going to be different. The terminology, but also the medicines that are used are going to be different depending on where it is that you are from. But those are things that can be easily implemented into your behavioral health practice. When I was working at the treatment center, there was always cedar and sage. You know, we always had it available for people. So, you know, I know we would start our day like that as a staff. We get there and we burn cedar and we'd sit there and just get ready for our day. But also, you know, people would come in, and throughout the day, we'd have clients and recoveries coming in all day just to come in and say, hey, you know, you have a cedar, and they'd come in and, yeah, it's over there, you know, here you go. And they'd come in and bless themselves and head out the door, you know, or sometimes they'd stick around, but at least they knew where they could come for those things, you know. And, you know, and that's an easy one to do. It's not hard to be able to have those things available and practice them. Some of the things that are a little bit harder to do when we talk about like sweat lodge ceremony, but at the same time, that's doable. You know, I know our behavioral health programs here on the reservations both have sweat lodges. They have one at the Alcohol and Drug Treatment Center, and then they have one at the Counseling and Family Services. So That offers 2 opportunities per week for either clients and patients of those facilities, or it's open to community members. So again, creating that idea of community, that the issues that we have are not specific just to those individuals, right? These are community issues, they're community problems. Therefore, they need community solutions. So we can create situations like having a sweat lodge ceremony that's open to community. Now we're creating kind of that helping environment where we're bringing people together to help each other through prayer, you know. So that's something I think probably a little bit harder to do, but again, not, it's doable. If you have people within your community that know how to do these things, all it takes is reaching out. And usually people that participate in ceremonies and call themselves prayer people, they're usually more than happy to help, and then community prayers. So I know our counseling and family services just wrapped up this series of community prayers that they were doing. They're having them over here at the Pala Arbor, I think every couple months or something, where they're inviting all community members out there, and they would go out and they would have time to have someone come out in prayer and cedar everyone off. They'd sing songs, and then I know this last one they had elders show up to tell stories, and then they'd leave it open too, just for people to share, and talk about whatever it is they had to talk about. But they did that as a staff, and then opened it up to community again. So creating that collective mindset within the community, and really promoting that, I think, healing on a whole level rather than just individual. When I was working for the treatment center, that was during the pandemic, so we weren't able to have our sweat lodge, but what we did is we moved our prayer online. So we were doing like a Zoom group, and they still have that going. So I know they just had it yesterday. So every single week, they're on Zoom on Tuesday, and people just gather together and pray together, and again, open it up for anybody that has things to share, sing some songs, and create that healing energy. But those are things that are all doable. Taking individuals to observe or to participate in other ceremonies. So, depending on where you're from, you may have other ceremonies. Here we have several different ones, but in the summertime we have Sundance ceremonies that happen. There's 3 of them here on this reservation. But we are taking clients out there. So we are loading up our treatment center van and taking our recoveries out there to go spend the day at the Sundance, just to observe and to see. What we found while we were there is that we had taken a few individuals out that had never been there before, and that was just amazing to me. As someone that's grown up with that way of life and grown up with some of those things, it was amazing to know that we have community members that had never ever taken part in anything like that. So again, when we talk about like the outcomes of our lives and our ability to overcome and adapt to trying times and hard situations, if we don't have that cultural background to lean on, where do you go? Where do you go for that? Especially, again, when we talk about living in a society where we haven't yet fully adapted to, and sometimes feel like we don't belong to, right? So if you have a place where you're here and you don't belong in this modern society, and then you don't know your traditional teachings, where do you belong? Again, it comes back to that identity issue. And how are you going to overcome some of the problems that you have if you don't have those things to lean on? So those are kind of a little bit some of the tougher ones to tackle. But there's all kinds of non-ceremonial things that you can do to implement culture into your practices. So gathering traditional medicines. You know, that was a big one. So I talked earlier about like having cedar and sage and things like that available and other medicines. We had those things at the treatment center. One of the things that I found is like asking people, well, do you do this at home? And a lot of people were like, no, I don't, because I don't have those things. Like, well, you know, you don't have any cedar, you don't have any medicine at home, and like, no, I don't know how to get it, or I don't know where it is. So right then we're like, okay, we need to show people how to do this and where to go get it. So we started doing that. We were taking people out to go pick cedar and to dig roots and things like that, you know. So that allowed them, not only it showed them how to do those things, again, the proper way to gather things, but it showed them where to get them, showed them how to take care of it and prepare it, and then they could do those things on their own, right? And now they have that at home and they can use it whenever they need it, because, you know, we talk about that, like relying on our ways and our way of prayer and things like that when we face a hard time. So if you have an individual that's going through some crisis and on the verge of relapsing or something like that, you know, and then they don't have those things at home, where do they go? You know, especially if it's after hours. Now you take that and you put it in their home, they have a place to lean on and they know what to do once they get in that situation if they can't get a hold of anybody. Gathering traditional foods. So I know our culture department here, throughout the springtime and summer is constantly going out and gathering wild carrots and different roots and, you know, berries and things like that. So, you know, being able to take individuals with those, because those things are open to the community. But what we find a lot of times is the people that need that the most, they don't have the resources to go and do those things on their own. So again, if you have vehicles within your program or your department, utilize those to help individuals get to and from some of those traditional gatherings and things like that. Preparing traditional foods, you know, that's an important thing. So, you know, an example, the tribes here, they give out salmon throughout the summertime and early fall. Give out salmon to community members. And one of the things that we found is that people weren't picking up any salmon. I was like, aren't you guys gonna go get your salmon? They're like, no, we don't know what to do with it. I was like, what? They're like, no, we don't ever eat it because we don't know what to do with it. You know, and I was like, well, you know what? I had the staff take all these guys and go get salmon, right? So they all went, came back with their bags of salmon, and the next day I brought my fillet knives, I brought my smoker, and I showed them how to gut and fillet and then smoke salmon, you know? So now I have people, this is 2 years ago, I have people today that say, hey Jason, I went and got my salmon. And I'm like, oh good, you know, it's good healthy food for you, traditional food. So, you know, again, taking some of the root of the problem and realizing like, hey, you know, healthy food, traditional food affects the way that we think. It affects the way that we operate. It affects our decision making. You know, how can we make that better for our people? And a lot of times, again, we can get those blinders on and not think about those other things. So, you know, kind of thinking outside the box. Growing healthy foods. Start community gardens. A lot of you guys may have open space at your facilities. Get a couple of boxes going. You know, you can get small 4x4 boxes. And you can do just a couple of them. You know, it doesn't take too much space. I know a lot of people have landscaping outside of their place, you know. If you have to, dig that up and grow some vegetables, you know. Figure out ways to do those things. Traditional games. So ways of getting people exercise. Again, how does exercise affect our decision making and our ability to be healthy and feel good about ourselves, right? Traditional crafts. So teaching people how to make certain things, beadwork, moccasins and things like that, dresses. So we had staff members that we only got sewing machines and they taught some of the ladies how to make sweat dresses. So, you know, they're making dresses and then using them at the sweat lodge at our place. Teaching individuals how to do all kinds of different crafts. So, those are things that can very easily be implemented. We talk about how do we do that? Much of the integration of culture can be expedited through the use of peer-based services. So when you talk about peer support and recovery coaches, peer support specialists, things like that. A lot of the issue that we run into in behavioral health is the ethics that we have to abide by as people that have certificates and licenses and things like that, where there's certain areas that they can't share information, or they can't do things that are a little bit more personal in nature, which again is that stark contrast to the way that we believe as Native people. So, I think our way around that a lot of times is to figure out ways to implement peer support services. And you can do that, I think, through hiring them or through volunteer. If you don't have the funding to do that, you can always get community members involved. I know with the sweat lodges, sometimes people have staff on board that can do those things. But a lot of times, places I've seen in other areas will just get people that know how to do those things and ask them from the community, hey, can you help us with this? And again, people are usually more than happy to help. With clinical services, you can adapt those. The only thing is that you have to think outside the box and be a little bit more creative. So, I'll give you guys an example here of how that can be done. So, one of the projects that I put together a few years ago is called Integrating Native American Traditions into Modern Day Living. And it was a project that I worked with our Shoshone Tribes Counseling and Family Services. And what we did is we put together a class for traditional family roles and family members, how to fulfill those roles in modern society. So again, we went to the culture department and I asked them, what are the most basic roles that you could think of that everybody should know? For men, for women, for children, for elders. Give me like the bare minimum thing that you think everybody needs to know. So they gave me this big list, So I put together this list and we put together this class to teach people, these are the roles for all of these different ages and males and females. And then I got together with Counseling and Family Services and got with one of the providers over there who worked with dialectical behavioral therapy, DBT, and we put this class together. So we went through the male roles, the female roles, for kids and children. For example, for males, we did like the whole idea of being a warrior, right? You can be a warrior, and I think when we think about like a stereotypical warrior, when you say that, a lot of people think of this warrior that's fierce and out there fighting and battling and doing all these things. But what we don't think about a lot of the times is why they did that. Why they did the things that they did. They didn't do that just because they wanted to be, all hardcore and awesome and fight and kill people. They did that because they were protectors of their people. They did that to ensure that the elders and the women and the children felt safe. They did that so that the village would be protected, right? So when we look at that today, we think, well, wow, warrior, we can't go out and do these things that they did. But we can look at the idea of why they did those things. And we can look at today, are we able to do that? Yes, we can do that. We can make sure our families feel safe and protected. We can ensure that we have safe homes for our kids and our wives and our elders to go to, a place where they can feel safe and happy, and houses filled with love, and make sure everyone feels protected, right? We can do those things. How do we do that? Well, we can make sure that we get jobs. We can make sure that we have income. We can make sure that we have money to provide food for our families. We can make sure that we have good living conditions for our families. We can ensure that we have clothing for them. We can do all of these different things and just take that idea and implement that into today's world. So, you know, we did that with all of the roles, and we took, how do we take the idea of that thing and why they did it, and then turn that into things that we can do today to make sure we fulfill that role. Some of the things are pretty transferable where they were the exact same. Like, we can still do those things. Like, I'm getting ready this month to go out and hunt. I can still do that, right? But again, some of those things were different. We just had to like figure out creative ways to kind of adapt those things to modern day. But what we realized is that as we were doing that, we were going to get a lot of people that maybe feel anxiety or sadness or anger because they're not going to know these things. And that's exactly what happened. So we had people that cried. We had people that broke down and said, I don't know who I am. But what we did is we implemented DBT into each segment where we thought people would feel this certain way. So we did things like mindful breathing, live in the present moment exercises, using your coping thoughts. And we put those at the exact moments where we thought people were going to feel a certain way within that class. What happened with that is that we had this whole classroom full of people that actually got to learn some of their traditional roles. They got to develop that discrepancy. They got to figure out areas that they need to work on. It fueled their ability to say, you know what, I want to learn more about who I am. We gave them resources of where to find those things, but more importantly, we implemented DBT, right? So if we were to just be straightforward with that and say, you know, all right, everyone, we have these issues of identity in our community, and it's because nobody knows who they are, and you guys all need therapy. So what I need you to do is come to our counseling center and sit through this hour of DBT therapy. Everyone would be like, get out of here. You know, I'm not doing that. You know, I don't believe in that. But what we did is we found a creative way to partner those things. And at the end, people got all of this help, and they didn't realize that they had actually gone through a therapy session, and they had also learned all of these different things that kind of fueled that hungriness to learn and to heal. So, you know, that's just a quick example of ways to think outside of the box. I'll leave it up to you guys, I think, to kind of take a lot of the information that we learned today and figure out how you can take some of that and find ways, creative ways to implement that into what you're doing. I think the overall message here really is just, you know, culture is the foundation of wellness and healing. You know, like I mentioned several times, the answers to all of our problems and all of our issues can be found within who we are. You know, finding that balance is key, and it's possible. You know, it's something that we can do. We just, again, we have to figure out how do we do that. You know, participation from our elders and community members is crucial. You know, having that collective mindset and trying to get that idea of, you know, healing as a whole, not just an individual. So, and we also must be willing to and able to think outside the box and be creative. You know, so I encourage all of you, you know, take this and ponder it and, you know, think of little things you can do. Like I said, there's big things like this class I just showed you, or there's just the little things of learning how to say hello in whatever native language it is with the community that you work for, you know. So there's tiny little steps you can take, or there's, you know, big leaps you can kind of try to implement. But that's my presentation today, you guys. So it was a lot. I tried to squeeze in as much as I can. I had to take quite a bit out. So, you know, here's just a little bit of information about me. So I will send this PowerPoint to Megan. She's free to share that. But if you want to get a hold of me, my contact info is here. And I'm always willing to talk to people about certain things like this. And you know, it's kind of my passion to work in this field and also just, you know, figuring out ways to implement culture into what we're doing. So that is all I have. And,
Thank you, Jason.
thank you guys for showing up, and thank you for having me today.